Hello and welcome to the first episode of Vojdani University. This is a monthly video series that we're going to be doing talking about the latest, greatest, newest in the scientific medical world, and particularly as it applies to autoimmunity. And allow me to introduce my guests who will be here every month to discuss all of these wonderful topics. Uh, I'm also lucky enough to have him as my father, Aristo Vojdani, PhD, um, known as the father of immunology. He is the chief scientific advisor for Cyrex Laboratories, also the president of Immunosciences Laboratories, and has been doing research in the field of immunology for decades now. And I'm honored to have you here.
Thank you, Dr. Elroy.
Thank you.
I'm delighted to be here and feel your passion for the field of immunology, especially the field of autoimmunology. That's a new terminology.
Yes, it is.
Autoimmunology. You are an autoimmunologist. That's what you are practicing in here. So also I'm very happy to be here that uh, things that I could not do as a scientist. You are capable of doing it because you are MD and you have the passion for the field. And also, the bottom line that you are here to help people with autoimmune diseases. As you know, 10% of the world population suffers from autoimmune diseases.
Yes.
This is a huge number. The solution is not to put them on antidepressants, on anti-immune suppressants. The solution is not to put them on immune suppressants and send them home, and that's it. That's why your passion is going to help to find the causes of autoimmunity and help manage your patients with autoimmune disorders.
Very true. And so let's talk a little bit more about um, the world of immunology and autoimmunity. And you mentioned the fact that an autoimmunologist doesn't really exist in classic medical training. So maybe you can talk to us a little bit about the history of immunology, how we're getting to this point of understanding autoimmunity.
I'll be delighted. First of all, I thank you for calling me the father of immunology or the father of functional immunology. I appreciate that. However, uh, from 1900, there were landmark breakthroughs by different scientists, which I call those individuals the father of immunology.
Give us some examples.
For example, Behring was the first one who took a toxin from diphtheria, injected to an animal,
Okay.
and then transferred the serum from that animal to another rabbit, and then injected again the toxin. The rabbit did not die.
Okay.
So if when you inject toxin, the toxin, if it's at high concentration, can kill the animal like the size of rabbit. So by making first antibody by injecting very low doses of toxin, meaning that the body made antibodies. At that time, they didn't know really the body made antibodies. But something happened against the toxin, so they even could transfer it from one animal to another animal and protect that animal against the toxin. So this was the landmark, the major breakthrough in the field.
So let me make sure I'm understanding you. So he took rabbits, injected them with a sublethal dose of diphtheria toxin, right?
Yes.
And then would re-inject those same rabbits sometime later with a lethal dose of diphtheria toxin, and they would survive.
Yes, correct. That was the first step.
Right.
Yes, definitely. The second step was if you take the blood from that rabbit, transfer it to another rabbit, and then inject the lethal
Right.
toxic level, those that will survive also.
So the protective benefit was transferable from one rabbit to another.
Fantastic,
Right.
fantastic. So
Excellent.
this is named as toxin antitoxin.
Okay.
Toxin antitoxin. Then a year after that, actually, Landsteiner, very famous name, Landsteiner, discovered the blood groups.
Okay.
And
Blood
then
type.
that was 1901.
Mm-hmm.
And then 1937, the same Landsteiner discovered the RH groups. So imagine how many children and mothers were dying because of blood transfusion, and this scientist contributed so much to the field
Sure.
of now blood banking and
Blood typing,
matching, and all of that,
right.
which is huge.
Something that we take for granted at this point, right? But in the past caused significant issues and morbidity with blood transfusion.
Absolutely.
Okay.
Then the famous Hashimoto.
Mm-hmm.
Hashimoto is the name of a professor from Japan.
Yes.
Who in 1914 actually discovered thyroid autoimmunity, but really they didn't know it was thyroid autoimmunity.
Right. You just knew it was a thyroid disease.
Exactly.
Right.
Yeah, some kind of thyroid disease.
Right.
Then during 1915, 20, 30, up to 35, they were playing with all these factors in the serum. And they were calling them antibody. Really, they didn't know the structure of the antibody.
Okay.
They didn't know this. There is IgG or IgM or IgM.
Okay.
Until a method, very important method, was introduced called electrophoresis.
Okay.
Which I use that in my,
This is
my
a diagnostic
PhD and my,
right.
master degree.
Right.
Method. It's a method of separating components of the serum to albumin, globulins, and all of that.
Right.
So what they found by this major breakthrough in the field of laboratory, that the antibodies actually were part of the gamma globulins. That's why they decided to name them immunoglobulins.
Okay.
So that was major breakthrough at that level. After 1939, 1940, they really didn't know what autoimmune disease was. They had some feelings.
Okay.
But the theory of autoimmunity was introduced by Sir Burnett from Australia.
Okay.
Who also has another theory of, the theory of selection of immunology and all of that, immune system, how it works, all of that. But however, he introduced a theory of autoimmunity, and guess what? All his colleagues, including Professor Coombs at that time,
sure.
was very famous because there is a Coombs test.
Yes. And what is the Coombs test?
It's also, again, in the blood bank.
Right.
He was so mad. He said that immune system is so perfect. It is wrong to call this autoimmunity because immune system never goes against its own healthy tissues,
right.
Never act against its own healthy tissues.
Right. So they were at the very beginning of really starting to understand the immune system and immune defenses, and they held on to this idea that the immune system in human beings is a perfect system, in that it had the ability to recognize self and non-self, and to them this was a very radical idea that this function can break down.
Absolutely.
And to this day is still a radical idea to some people.
Yes,
right?
Yes. But he was lucky enough at that time that rheumatoid arthritis was also discovered right at the same time.
Okay.
So, so when rheumatoid arthritis was discovered, and by the way, the history shows that rheumatoid arthritis and autoimmune diseases has been there for probably 400 million years.
Sure.
Because they found that the bones of dinosaurs had some kind of holes in them.
Okay.
So that's just, So autoimmune disease has been there, but they were not recognized until 1940.
Right.
And then around 1950, they found a patient who had both rheumatoid arthritis and lupus.
Okay.
So these were the major breakthroughs. Then around the same time, 1955, they discovered the structure, the molecules, the IgG, the IgM, the IgA. What is their structure, Y-shaped material, the molecular size, and then also IgE was discovered at Johns Hopkins University.
Okay.
So those, that's exactly the time that I went to Bar Ilan University in Israel and started, studying immunology. So they were teaching us about all these major breakthroughs.
Right. And this was more than 50 years ago.
Yes.
And here we are today.
Yes.
Still struggling with the concept in conventional medicine that autoimmunity is the basis for many diseases. Why don't we talk a little bit about what the definition of autoimmunity is?
I'll be very happy to do that, but let me just touch a couple more issues which made huge difference in my life.
Okay.
So in 1975, major discovery happened in the laboratory setting. And that was introduction of a method called ELISA, enzyme linked immunosorbent assay.
Right.
Just, think about this possibility that you can take instead of a tube that, we used to do agglutination. You add antigen, antibody, and you look for precipitation or agglutination.
Clumping of the molecule.
Now suddenly you can look at color development, which is indication of antigen antibody reaction.
Right.
The advantage of this is that they could develop spectrophotometers also to measure the intensity of the color and therefore quantitation of the antibodies.
Right.
So Engelwald and Perlman from Germany were the one who discovered this method.
When?
And
in the 70s?
75.
Right.
So that was a major breakthrough. And then, as you know, I came to UCLA in 1979 for postdoctoral studies, working with Professor Cooper, not far from here, about 2 miles from here. And then I was to be honest with you, a little bit frustrated. A young immunologist coming to the USA, spending almost a month or a year, and waiting to learn something that will make a difference in my life. And it didn't happen.
In the field of immunology? In
the field of immunology. Okay. I was learning something here and there, but it wasn't a major one.
Okay.
So I heard about ELISA, but I didn't know how to go and learn about ELISA.
Okay.
So one day I was walking on the 4th floor, which is the medical building of UCLA, which is immunology department. They made an announcement that there is a workshop about ELISA.
Perfect.
Perfect timing, right?
Yes.
And listen, at that time, I have to share this with you and the audience that I really didn't have much money.
Okay.
I was working at UCLA with no salary.
Right.
So I had to survive. We didn't have kids yet.
Right.
So $350 for 2 days was a lot of money.
Yes.
But I paid that $350.
Okay.
And went for 2 days of workshop, hands-on, how to do ELISA assay. So I learned that and then took that to the laboratory. Practiced so much, I became the expert how to run ELISA assay. And believe me, today I'm sitting here that method completely changed my life.
So it was money well spent.
Absolutely. I was impressed to the degree that when your mother was pregnant with you in 1981-82, that I said, if you were going to be a girl, I was going to call you ELISA.
Well, Very thankful that I'm not a girl.
So let's have a little bit fun also.
Yeah, of course.
So anyway, that made huge difference, you know. Using that method, today I'm sitting here, I developed more than 300 different ELISA assays, which you were involved with me. You
Yeah.
worked with me since you were high school.
Yeah, we've been working together, since I was 15
Yeah.
in
So
the laboratory.
you were in the laboratory, you observed ELISA technology.
Yeah, I ran the
You
testing.
observed cellular immunology
Sure.
testing, other testing. You wrote articles with me, and so you know it was great honor to be working with you.
Great honor for me too. I got training from the best.
Thank you. So one more breakthrough happened about that period of time, 1975, 1980, was the discovery of monoclonal antibodies.
Okay.
As you know, today they are used for target therapy
Yes.
in the field of autoimmunity.
Yes.
Whether you agree with that or disagree
Yeah, it's
with
a
that,
very
that's a different
controversial
story.
treatment, but that's when they were developed.
Yeah, target therapy for cancer. That's how they're using.
So, what is a monoclonal antibody?
Okay. If we take an antigen, soy protein,
Okay.
and inject it to an animal, rabbit,
Right.
that antigen goes to different lymphoid organs,
Mhm.
including spleen, and lots of lymphocytes become specializing in making antibodies.
Against
plasma,
soy.
we call those plasma cells
Right.
against soy.
Right.
But because so many plasma cells of different kinds become activated and make antibodies against different components of soy,
Okay.
we call those polyclonal antibodies, meaning the antibodies are made by many plasma cells.
Okay.
They are not one cell that was divided, a clone of cells, we call those, and then antibodies were made by that.
Right. So many plasma cells contributed to making antibodies against soy. Some of them to different portions of
That's
soy.
right, that's it.
Right. Not all of them to exactly the same portion of soy.
Exactly.
Right.
So that is polyclonal antibody.
Okay.
We talked about it.
Yes.
The monoclonal antibodies was very brilliant. If we inject mouse with the same soy protein we talked about
Okay.
and separate plasma cell from the spleen, just one
Yeah.
plasma cell,
Mm-hmm.
then fuse that plasma cell with another plasma cell from a patient with multiple myeloma.
Okay.
What is multiple myeloma? Plasma cells dividing and making lots of proteins. It's a factory of making proteins.
Uncontrolled replication of the plasma cells.
Now,
essentially.
so imagine we injected soy antigen
Right.
to a mouse. We
Right.
separated one plasma cell,
Right.
and now we fuse that together.
And it replicates like crazy.
So the DNA from this cell goes in there.
Yeah.
And that cell replicates like crazy and make lots of proteins, but one of those proteins will be antibody against soy.
And one specific antibody.
Very specific antibody against soy.
Right.
And so therefore, by getting rid of all other proteins, now you have 100% soy protein, which we call that monoclonal antibody against soy.
Right.
So they took this idea, they applied that, for example, to TNF alpha.
Sure.
They made monoclonal antibody against TNF alpha,
Which we see on the market today.
which, by the way, humanized that. We can,
Right.
what is humanization? Meaning taking two human cells
Right.
and infuse them,
Right.
and then you make
Right.
anti-TNF alpha, and now is huge market
Yes.
for treatment of patients with rheumatoid arthritis.
The highest sales in the United States pharmaceutically last year was Humira.
Okay, fantastic.
Right.
With the same idea, for example, if you have a patient with breast cancer,
Mm-hmm.
CA-19 or cancer antigens, you make monoclonal antibodies against that.
Right.
You can take that antibody, which goes only after the protein of um, breast cancer cells,
Right.
and add to that a toxin, will deliver that to all the tumor cells and cause destruction of the tumor
Sure.
cells.
To any cells that express CA19.
So we call that targeted therapy.
Right.
So this was huge, 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 and you can see the impact on the economy of the world.
Yes.
Is just one finding.
Right.
That's why I'm calling these landmark discoveries.
Sure.
So finally, building on all of this, that I can take credit for some of this, that developing all these assays, and so the idea of predictive antibodies came into fruition. That's what we are doing with Cyrex Laboratories, and our idea, as you know, you were involved with this, is to detect autoimmune diseases at early stage as possible, so prevention will make huge difference in the life
Right.
of the patients.
Right. So in talking about autoimmune disease, right, this is a disorder of the immune system of a human being where some portion of the immune system is not functioning the way it should. It is recognizing self tissue as a foreign antigen and attacking it through various mechanisms, usually by antibody formation, right?
Absolutely.
So
Absolutely.
why don't we talk about a few examples of autoimmune disease?
But let me conclude that part.
Okay.
It was so finally, based on that introduction, that really I'm not the father of immunologists. Those are the fathers of the immunology.
Sure.
I am the son of immunology.
Okay.
And you are the grandson of the immunology.
I'm honored to be
Yeah.
there.
So really that's we have to give credit to this.
Definitely.
So you asked me earlier what is autoimmunity. You explained that, but let me one more time to define.
Please.
Is autoimmunity is immunity against self.
Right.
As you know, that the body has a mechanism which can differentiate between self versus not self.
Mm-hmm.
So the immune system built in such a way that lymphocytes migrate from the bone marrow, to the thymus or lymphoid organs to become T cell or B cells. So when they migrate from bone marrow to the thymus to become T cells, it is within the thymus gland where they get their education.
Mm-hmm.
Lymphocytes who carry receptor for self,
right,
should be destroyed completely.
Right.
Lymphocytes who carry receptor for not self, bacteria, viruses, parasites, molds, spirochetes, they should survive,
right,
and protect us against any future encountering of these pathogens.
Mm-hmm.
So that's how the immune system is built, to differentiate between self and not self. When this mechanism breaks down, the results of that could be autoimmunity.
Okay. And the immune system has many safety features built into it, right? That's why when you talk to immunologists in the 50s and you told them that there's an entity such as autoimmunity, they didn't believe it, right? Because there are a lot of features built in where this breakdown shouldn't happen.
Absolutely. That was Sir Burnett claimed that please don't call this autoimmunity, call this autoallergy.
Okay.
Autoallergy. There is no such thing as autoimmunity. Our immune system is so perfect. No way the immune system will break down, because there are so many levels of protection.
Right. Right. Yeah. So
examples.
Please. Examples of autoimmune.
Let's take just the skin.
Okay.
Because skin, we forget, is a major organ.
Yes.
The largest one.
And the first part of the immune system is really the skin and it's a barrier.
And the mucosal,
right?
Yes.
Mucosal surfaces. Skin and mucosal surfaces are the first line of defense of our immune system.
Absolutely.
They're a barrier.
Yes, absolutely. No, but unfortunately, we have vitiligo,
Right.
we have psoriasis,
Sure.
we have scleroderma,
Eczema.
eczema. Maybe we can call that autoimmunity or not, but maybe that's more allergy. Pemphigus,
Yes.
pemphigoids,
Yes.
and even part of the systemic lupus erythematosus.
Yeah,
That's
sure.
why the butterfly.
Sure.
So there are like just with skin. I just named 6 or 7 different autoimmune diseases.
Yes.
Now let's go a little bit down into the digestive tract.
Sure.
We have, first of all, pernicious anemia.
Okay.
We make antibodies against our own intrinsic factor,
Yes.
B12 deficiency.
Right. You can't absorb the nutrients, therefore the red blood cells don't form the way they should, and you end up anemic.
Celiac disease,
Sure.
non-celiac gluten sensitivity,
Yes.
Crohn's, ulcerative colitis,
Which are both inflammatory bowel diseases in the category of IBD.
irritable bowel syndrome now is autoimmune disease.
Right. For years
And
and years.
SIBO also is autoimmune disease. Why? Because, as you know, that now we are in the middle of research together, that making antibodies against cytoskeletal proteins,
Yes.
such as vinculin and taurine and actinin,
Right.
that's autoimmunity.
IBS, for many, many years, was really just considered, so you were just born with a sensitive GI system, and that is, people would say you're kind of out of luck. Don't drink coffee, don't eat foods that irritate you. You're just kind of born with a sensitive stomach. And now we're really starting to understand, one, that IBS is an autoimmune disease,
Yes.
and two, there's a huge association between SIBO, which is small intestinal bacterial overgrowth, and IBS. There is major overlap between the two of them, and maybe those two will start to merge into really one disease in the future.
Yeah, absolutely. The beauty of this is that we are learning about mechanisms. The bacteria making a toxin, highly toxic, damaging cellular DNA.
Right.
That's why they call that toxin genotoxic
Mm-hmm.
or genotoxic. So this bacterial toxin not only is damaging the cytoskeletal proteins, such as vinculin, taurine,
Yeah.
but also cross-reacts with them, meaning has an antigenic similarity with cytoskeletal proteins.
Right.
You make antibody against the toxin, the antibody turns against yourself.
So let's talk about that. Let's clarify that. So you have dysbiosis or pathogenic infection with a certain bacteria, and that bacteria, because of its toxin, can physically break the barrier of the intestinal lining, right? And
Not only barriers, the cellular
the
structure.
structure. And then not only can it do that, but when the immune system starts to target the bacteria by forming antibodies as part of the adaptive immune system, those antibodies also cross-react with cytoskeletal proteins. So you get a 2-for-1, autoimmunity and also direct damage.
Absolutely.
Right.
Yes. So we named right here another 5 or 6 or 7
Sure.
just in the gut.
Sure.
Let's go to the joints.
Right.
Rheumatoid arthritis, psoriatic arthritis,
Yes.
and
Ankylosing
osteoarthritis.
spondylitis.
Yeah, that's another.
Yes.
But the most prominent autoimmunities, unfortunately, are against our brain cells.
Yeah.
And we'll talk about that probably in one session, why brain is so much target of autoimmunities.
And this one has the ability to impact the quality of your life the most. I mean, we all know someone, unfortunately, we all know someone with a neurodegenerative autoimmune condition, whether it be MS or early Alzheimer's, and these are devastating. And even we're finding some autoimmune related connections between migraines and cluster headaches and really very debilitating neurodegenerative diseases. So this is one of the areas where we can make really significant impact on the quality of life of a human being.
Yes, absolutely. So multiple sclerosis,
Yes.
ALS,
Yeah.
neuromyelitis optica,
Right.
peripheral neuropathy,
Mm-hmm.
neuropathy in general, and there are many more autoimmune
Sure.
diseases associated with the brain.
Sure.
And so the bottom line is there is no single part of our body which is not target of autoimmunity.
Yeah.
Every single part of our body could be a target of autoimmunity.
We also talked earlier about Dr. Hashimoto in Japan, and this is another very prevalent autoimmune condition. Especially, this was discovered in Japan, but we have a huge prevalence of it in the United States, Hashimoto's thyroiditis. Talk a little bit about Hashimoto's. We are forming antibodies against a portion of the thyroid gland, right?
Absolutely. Which is thyroid peroxidase.
Right, TPO.
But with that, let's give credit to another son of immunology, Dr. Noel Rose from Johns Hopkins University. I believe today is about 92 years.
Okay.
He spent his entire career in the field of autoimmunology. In 1955, so after Hashimoto, Professor Hashimoto, that discovered that, and then later on they found out that we make antibodies against thyroid peroxidase.
Yep.
This is Dr. Noel Ross, made major discoveries. He took rabbits and took the thyroid gland and extracted an antigen from the thyroid gland. He didn't know then was thyroglobulin.
Okay.
Because thyroid peroxidase versus thyroglobulin.
Right.
And when he injected to another rabbit, unexpectedly found that the other rabbits became sick, developed another thyroid autoimmunity called Graves' disease.
Right. So Hashimoto's is a autoimmune thyroid condition that results in hypofunctioning of the thyroid gland, and Graves' disease is the opposite.
Could go both ways.
Right.
Yeah, but in both cases, we make antibodies against the components of thyroid gland.
Right.
So in this case, when he did experiments, he didn't expect, because we are saying that the immune system should differentiate between self and versus non-self, right?
Right.
That was my definition earlier.
Right.
So how come he took thyroid gland extract, which was actually then later purified and found that was thyroglobulin,
Right.
and injected that to the rabbit developed thyroid autoimmunity.
Right.
And so he spent many years to find out, actually sometimes when we have hidden tissue antigens.
Mm-hmm.
If you look at thyroid gland, let's say it's it's covered by some kind of barrier.
Yep.
But the thyroglobulin and TPO or microsomal, we used to call that, they're inside.
Right, they're inside the cells.
Yeah. So when you extract that and inject it, the body recognizes it as not cell.
Right.
Because during the 3 to 6 months of our life, as you know, that the tolerance mechanism develops, right?
Right.
Because our cells never had any communication with thyroglobulin or thyroid peroxidase,
Sure.
which is inside.
Right.
That structure, then the body recognizes that they're not self, react to it, and we make antibody against that.
Okay.
So today, hypothyroidism is huge, about just 14 million people just suffering from hypothyroidism, and where they make antibodies against their own thyroid gland. And the next part is that if thyroid is so perfect, okay, covered with all these structures, so how come we make antibody against it?
Yeah, it's a very good question.
Right? So it seems that some kind of environmental factors,
right,
virus, bacterial toxins,
right,
chemical toxins, can penetrate that barrier and cause release of thyroglobulin and microsomals into the blood, and now we are going to react against that,
Right.
and we make antibodies. I think there's a terminology called sequestered antigens,
Yes.
meaning the antigens are hidden inside,
Yes.
but now they're not hidden anymore.
Yeah. And unfortunately, we know so many people out there, so many patients who are on thyroid supplemental medication, and very few health practitioners, doctors are asking, endocrinologists are asking the question, why did this happen to your thyroid gland? What can we do to reverse that process so maybe your thyroid function comes back a little bit, or at least you stop the progression of the thyroid damage? And really, this is a different way of thinking about autoimmunity that very few people are even talking about. It's just we'll give you the thyroid medication to make up for what your thyroid can no longer do. And you're really bypassing, in doing that, you're bypassing what your body's intention is. And our idea here is let's restore the immune system to what it's supposed to be doing. Let's remove whatever is causing the thyroid tissue to be exposed to the immune system, and let's try to bring function back to normal.
Yeah. Earlier, remember I mentioned that you are the most qualified autoimmunologist.
Thank
The
you.
reason for that is you work in the clinical laboratory, you did research, you are familiar with the methodologies, you are MD. So by putting this whole thing together and emphasizing the role that the triggers play in the induction of autoimmunities, you are going to make huge difference in the life of the patients. That's exactly what you were talking about.
I hope so. I hope to continue, all of the work that you've done and really start applying it more and more and more to individuals who walk through this.
Because without looking at the triggers of autoimmunity, triggers could be a virus, as I said, in the case of thyroid autoimmunity, other autoimmunities.
So infectious pathogens are one of the triggers of autoimmunity.
Toxic chemicals.
Toxic chemicals, which we all know more and more and more in our industrialized world. Those of us living in cities, unless you're living in the middle of the woods in Washington, if you do, I'm very jealous of you. Unless you're living in that condition, you're exposed to toxic chemicals every day.
Yes, and then the food antigens. And again, we may have special session just for each one of these.
Yes, so in the future episodes of Ojdani University, we will be discussing each one of those subcategories and their application to different autoimmunities.
Because what happened to the food?
Yeah.
That 50 years ago, the immune system was not reacting against it. Now we are reacting against it.
Right.
Those are kind of questions.
And these are things that everybody in the United States are exposed to on a daily basis.
Absolutely.
Right.
Right.
Okay. So let's go back to that case. To me, the case of Hashimoto's thyroiditis is very interesting. As an interventional radiologist, I had a lot of exposure to thyroid disease, also reading thyroid ultrasounds. I have an ultrasound machine here myself so that I can take a look at, in the case of autoimmune thyroid disease, how much of the parenchyma, the cells of the thyroid gland, have changed. It's a very useful marker on top of what blood testing is showing, right? How much anti-TPO antibody you have, how well your thyroid is functioning. I like to take a structural look at the thyroid gland itself.
That's a fantastic idea.
Yeah.
Because you know that the antibodies fluctuates even from day to day.
Yeah.
I have heard the experts.
Yeah.
That one day they measure TPO antibodies 4,000, the next day is 500.
Yeah.
So it seems, first of all, when you measure antibody, how do you know where those antibodies are produced? They were produced yesterday,
or 2 weeks
ago, or 6 months ago.
Right. You don't know.
That's why the advantage of having this methodology, this technology, the ultrasounding of the thyroid gland is extremely, extremely important as an adjunct to other methodologies.
And in my experience and my belief, it also gives you the ability to track whether structural changes as treatment is going on. You see the blood testing kind of move in a positive direction, but you also want to see structural changes as well.
Absolutely.
In a positive way. So yeah, that to me, Hashimoto's thyroiditis is so interesting. We mentioned that viruses, bacterial pathogen exposure can be the trigger for Hashimoto's. Why don't we talk about one of the viruses that's well associated with Hashimoto's, Epstein-Barr virus, EBV.
Yes.
What is the mechanism in which EBV contributes to Hashimoto's thyroiditis?
Okay. You have seen that presentation we put together.
Yes.
About the role of pathogens.
Yes.
In autoimmunity.
Yes.
Epstein-Barr virus, H. pylori,
yep.
Yersinia enterocolitica,
yes.
Epstein-Barr virus mentioned earlier, all of them share an epitope and antigenic or amino acid similarity with thyroid gland.
Do you mind if I just
please.
make that a little bit more in layman's terms, right? So those infectious agents, Epstein-Barr virus, Yersinia enterocolitica, H. pylori, 3 very common infectious pathogens. When the immune system attacks them, there is a portion of those viruses which is very similar, the protein structure is very similar to a portion of the thyroid parenchyma, right?
Yes.
So continue.
So now immune system is attacking the pathogen.
Yes.
It makes antibody against that component, that necklace. Combination of amino acids, that antibody, if penetrates parenchyma of the thyroid and binds to thyroid stimulating hormone receptor or thyroid peroxidase or thyroglobulin, causing what?
Autoimmune thyroid disease.
Autoimmune thyroid disease.
Yes.
That's the mechanism. Now we are talking about the mechanism of action, which many people do not pay attention to.
And let's talk about why it's so important to talk about the mechanism of action, discover why this happened, because it gives you the ability to go down to the very basic of the pathogenesis of the thyroid disease and remove that, the whole thing that's causing this wheel to start in the body, remove it, and therefore remove the disease process. So in the case of Epstein-Barr virus infection, you can support the immune system to clear that infection and therefore stop producing antibodies against it that will be circulating in the system and therefore not react to thyroid tissue.
Yes, in a case of H. pylori, thanks God there is a treatment.
Yes, a very effective treatment.
Yeah, very effective treatment.
Yes.
If you can, suffer for 2 weeks and get that triple treatment and reverse the autoimmunity against your own thyroid, that's not a huge price that you are going to pay. You are going to enjoy it for the rest of your life.
Right.
But that's why it's so important to find the triggers.
Yes.
Or Yersinia enterocolitica.
Yes.
Also, by treating the gut, supporting the gut, probiotics, and many other remedies that you are expert, you can help.
Absolutely. And this is the decades of work and research that you have been doing in your entire career have come to this point now that we have reliable, fast, efficient diagnostic methods to identify these predictive antibodies, these things that show that your immune system is reacting to foods, your immune system is reacting to toxic chemicals, or your immune system is reacting to infectious pathogens. And those predictive antibodies give us the idea as to where the autoimmunity is coming from. We can remove those triggers and therefore remove the process of autoimmunity.
So what you are talking about actually is the famous detect,
yes,
remove, and repair.
Right.
So that's really our
right.
Yeah.
Detect, remove, and repair. The Vojdani continuum of diagnosis, removal, and treatment.
Absolutely.
Right?
Yes.
So that is really the work that you have perfected over decades that we are bringing into my practice and what I am very, very thrilled to be able to offer to everyone out there who walks in through the doors. It really is a privilege to have learned all of this from you and to be able to help so many people with it.
Thank you. And again, I appreciate your passion for the field of autoimmunity.
Yeah.
And I encourage patients out there who suffer from autoimmunity come and see you because you know how to help them.
Thank you. I appreciate it. So we're going to wrap up episode 1 of Vojdani University. You can look forward to this once a month. Once again, I'm Elroy Vojdani, MD. I am the physician founder of Regenera Wellness. For more information, to access these video posts, you can visit regenerawellness.com. You can call our office at 424-256-0272 or email info@regenerawellness.com with any questions you might have. Dr. Vojdani, it is always a pleasure. As always, I always learn something from you. And in our future episodes, we're going to cover specifically how food affects autoimmunity, how chemicals affect autoimmunity, and how infectious pathogens affect autoimmunity. And we're going to keep this going as long as we possibly can. If anyone has any suggestions for a topic, please send them to info@regenerawellness.com and we will do our best to cover that topic.
And I'm looking forward to additional episodes.
Thank you. Me too.
Thank you.
Thank you, guys.